Hello everyone, this is Tumishe. Today I'll be talking about sickle cell disease. I'll be talking about the complications of sickle cell, defining sickle cell, and we'll just be taking basic topics on sickle cell. We'll be talking about the complications and diagnosis of sickle cell and what sickle cell entails. So, what is sickle cell? Sickle cell disease is an abnormal red blood cells that is a genetic blood disorder. So, it makes these blood cells to become rigid, and it is shaped in this crescent form or a sickle shape instead of the normal red blood cell. So, let me draw this normal red blood cell. The normal red blood cells is shaped in zero in an O form. The normal red blood cells, I don't know if we can see it, is shaped in an O form, while the sickle shaped is shaped in a sickle or a crescent form. It's shaped in a sickle or a crescent form. So this is the normal red blood cell. It is O, while the sickle cell red blood cell, it's an abnormal red blood cell. It is shaped in a crescent form. So the abnormal red blood cells leads to various health problems in sickle cell patients. Now let's talk about gene and causes of sickle cell disease. Sickle cell disease is caused by a mutation in the hemoglobin beta gene. That means that a person needs to inherit, for a person to inherit a sickle cell disease, both parents must have a sickle cell trait, one from each parent. So if I have sickle cell disease, both my parents must have a sickle cell trait each to make me a sickle cell patient. Carrying one sickle cell gene does not cause symptoms that can be passed to offspring unless maybe the other partner also have a sickle cell gene or a sickle cell trait which can make the offspring have sickle cell disease. Now let's talk about sickle cell complications and causes. Number one is painful crisis. This is where this patient, someone with sickle cell disease, have a chronic painful episode of pains, severe pains all over the body, or pains in the chest, anywhere. Pains can happen anywhere. This is due to the fact that there is blocked blood flow in the body. And two, we have chronic anemia. This is sudden weakness, general weakness in the body, due to the fact that these blood cells are quickly destroyed in the system. So we also have severe jaundice. This is coloration of the yellowing of the eyes and of the skin. This is due to severe breakdown of blood cells. And we also have stroke. This is when there's shortage of blood going to the brain. And then we have organ damage like the liver, the kidney, and the spleen can also get damaged due to sickle cell complications. We also have infections. People living with sickle cells are prone to having infections, especially in the spleen. So there are a lot of sickle cell complications which affects people living with sickle cell disease. And then we look at sickle cell diagnosis. How can you get diagnosed that, oh, you have sickle cell? Or how do you want to check? How do you know that you have sickle cell disease? Number one is by blood test, by going to the lab to get your blood tested for genotype screening. And we also have newborn screening, where there are standard labs where you can even get your newborn to check for their blood, to check for sickle cell disease in their blood. Now let's talk about management of sickle cell. Number one is pain management. Pain management, this is where the patient, someone living with sickle cell, can actually take medications that reduces the pain crisis. And then we have a drug called hydroxyurea. It is always given by an hematologist. This helps reduce the pain in the body, and it reduces the rate at which a person living with sickle cell have frequent pain crisis. And then we have blood transfusions. Blood transfusions also helps to reduce pain crisis or pain or acute chest syndrome. Blood transfusions also help in pain management also. Blood transfusions also help in severe anemia, and it helps reduce weakness, maybe shortage of blood in the system. Blood transfusion also helps in that aspect. And then we have bone marrow um, bone marrow treatment. This is a cure to sickle cell disease, but it has a high risk for people living with sickle cell. Bone marrow transplant is also a cure. It's a permanent cure, potential cure to sickle cell disease. So let's talk about lifestyle and support. In lifestyle and support, we see that it is very important for someone having sickle cell disease to go for regular checkup with an hematologist, and also for healthy lifestyle like eating healthy balanced diet food, eating fruits. Taking fruits is very important. Avoiding extreme cold, avoiding extreme temperatures, avoiding vigorous exercise, taking regular water, hydration. So, and also taking care of the body, taking care of the system to avoid infections. So this type of healthy lifestyle also help improve health of people living with sickle cell disorder. In conclusion, sickle cell disorder is only a genetic blood disorder, because people think that sickle cell disorder or sickle cell disease can be contaminated or can be transmitted. Sickle cell disease cannot be transmitted. It is only gotten from incompatible genotype, AS getting married together. This produce sickle cell. So making this video, I am trying to create awareness for people that doesn't know much about sickle cell disease. To help, please share this video. Let people know that sickle cell disease, a lot of people have sickle cell disease, especially in the black community. So please share this video for awareness, for people to know that before you get married, you need to check your genotype, and you need to check it in a standard lab, so that you will not marry or birth children, so that you will not birth children in pains. Sickle cell disease is a very, it affects a lot and major lifestyle of the person living with sickle cell. It affects mental health, it affects physically, it affects emotionally, it affects everywhere, even the lifestyle of the person living with sickle cell. So please, for awareness, please help share this video, and please check your genotype before getting married. More of this educating and interesting topic about sickle cell disease will be coming up. Please like, comment, and share on my page. Encourage me. This is Tumishe. I am living with sickle cell disease. Thank you. Bye.